went to a community college for a short time, got very bored, was working at the same time, and decided, okay, that's enough of that. And so I quit. I originally wanted to be a teacher, a business teacher,
Okay.
and kind of wish I had pursued that. But I've been in business. I've been working since I was about 14. So lots of time spent working, and I got married young. My husband and I lived in Dallas for about 8 years, uh,
Okay.
and he was going to school in Fort Worth. And then we moved to Seattle just because we wanted to live here back in 1988. So
Wow.
long time ago.
Man, you've
Um,
seen a lot of change in Seattle, I would think.
Oh yeah, it's changed completely. But it's funny because when I was diagnosed, I sent a note to a guy that I worked for in Dallas. I worked at the Hyatt, and he helped me get a transfer out here because they were building a hotel in Bellevue. And so I sent him a note and told him what was going on. And I said, little did either of us know how important your help was going to be all these years later, because getting here to a city where cancer care is top of the list. The Seattle Cancer Care Alliance and Fred Hutch pioneered bone marrow transplants. And so I couldn't have been in a better place for what eventually happened. And so I gave him a little bit of
Wow.
credit for
That's
helping
a
me.
that's amazing. That's really
Yeah.
incredible. So I wasn't aware of that. This is a kind of little gems of information that people would like to know. Is who's on the cutting edge of bone
Mm-hmm.
marrow transplants in the United States. These centers of excellence are a lot of
Mm-hmm.
them claim to be there.
Right.
But what would you expect them to say now when somebody who's been through it has done the homework and navigated through it
Yeah.
can actually attest to that fact. That's awesome.
Yeah, it's well. In fact, a few days after I had my transplant, they performed the millionth bone marrow transplant in the world. A million have been done since October. In October 12th, the millionth one was completed. And the guy who figured it out, everyone thought he was crazy when he started saying this could work. And he eventually was one of the founders of Fred Hutchison. And so 40 years ago, he figured out how to do it. And they had one or two patients. And if I'm remembering correctly, the first one survived, I don't know, not that long, maybe 3 or 4 years, but that was longer than anyone had ever survived with leukemia.
Right.
So it was quite a feat. And then, of course, they've certainly improved on it, and their science is unmatched, I think.
Wow. That's incredible. So, do they have a specialty in leukemia? Because there are certain places that might deal with, say, a blood cancer that might be, a different place in the country versus, say, a leukemia. Are they particularly well known for the leukemia treatment?
Actually, they're well known for all kinds of cancer treatment now. That
Okay.
was, years ago. I just went to a class they had there a couple weeks ago, and up on the wall was kind of a timeline of what's happened with Fred Hutch over the years. And I think it said 1969 they had 8 patients, and in
Wow.
2012 they had 15,000 patients.
Oh my
Uh,
gosh.
yeah, so it's grown by great leaps and bounds. But in addition to that, about probably 12, 14 years ago, they partnered with the Seattle Cancer Care Alliance, which is kind of a conduit. Fred Hutch is more the research arm. The SCCA is the treatment arm as far as heading up your treatment. And then University of Washington Medical Center is where your treatment would take place. So I have my transplant at UW Medical Center, which is a hospital. The SCCA was in charge of that treatment. The physicians are University of Washington physicians. So it's a big alliance. And then a part of that, which didn't affect me, is Seattle Children's Hospital. And of course they do miraculous things in the lives of kids every single day. So it's pretty amazing group of organizations that partner together to to combat cancer.
Was Liz actually there at the event that you went to? Did you guys
Yes,
reconnect
we went
there?
together.
Oh,
actually.
so that's how you learned about us. That would make sense. Sorry.
Yeah. She had told me about it before, and then when we were there, we talked about it a little more, and she sent me the link. And
Yeah.
in fact, she sent me a note and said, "Oh, I can't believe you're doing this, and I haven't even done it yet."
Yeah,
So,
I know. You're going to have to razz her about it a little bit. I know
I
she's
will.
busy, but yeah. So we can go ahead and get started. It's really more like a conversation more than anything, Lori.
Sure.
I wanted to chime in.
Yeah,
real
go
quick.
ahead.
I need you to either turn off the fan or turn down your gain, because it's
Okay, I'm going to turn off the fan. Just give me 2 seconds. I've got an overhead fan. It is Texas, Lori. So
That's right.
Yeah.
You're in the hill country, right?
I'm in the hill country. I'm a little north of San Antonio, which is now home of the world champion Spurs. So
Oh, yeah,
I don't
that's
know if
right.
you watch basketball, but
The night the air conditioning went out, I saw a little bit.
Oh, I know. Good planning on that part, right?
Yeah.
Yeah.
Yeah, his audio was just getting a little loud. I wanted to. I'm not sure if you were having the problems too.
I could hear a little bit of background noise, but not much.
I think this might solve the problem. I was having it was jumping back and forth between who was speaking way too quickly, and it was frustrating. But I think that should be good, and I'm gonna turn down your gain just a little bit, Dad.
Okay.
Yeah, you sound very clear, Jamie.
Well, thank you.
Yeah, Jamie, you sound really clear.
And that's better, Jim. You
Is it?
sound more. Yeah, it sounds clearer.
That's much better. Yeah, you had a lot of background noise, and I could hear you like rustling around. So.
Oh, wow. Okay. Yeah, I had this gain turned up. We've got this real fancy mic, Lori, and I'm trying to figure out, all the details on it. But
Best way to use it.
yeah, exactly. So, just so that I kind of roll into the show, I just want to be sure I kind of have a good feel for your background a little bit. So you're from the Midwest and been in Seattle since '88 or so, and got a feel for the background of the location. But let's get a little bit more background about you personally, just so that people will have an idea of who they're talking to and kind of relate to a little bit about your background.
Sure.
So,
well, my husband and I've been married almost 34 years.
congratulations.
Long time, and we've, like I said, we lived in Seattle about 25 of those. We don't have any kids. We have a Springer Spaniel named Casper, who takes up a lot of our time and attention, and he's great. And actually, that was one of the toughest things. Was you can't explain to your pet what's happening. They don't understand. And so I was, locked away in a hospital for a month, couldn't see him. And I remember saying to my doctor, "You mean I can't see my dog for a month?" And he said, "Well, we kind of have ways around that. If you really need to see him, we can take you down to the front drive and you can have a little visit." And
Wow.
I thought that was very compassionate. He's a dog guy.
That is.
Yeah.
That's unusual. So.
Yeah. He got it. But I thought that would be harder to actually see him and not be able to spend any time with him. So my husband would bring him and walk him outside the hospital. I was up on the 6th floor, and I could look out the window and see him. And we had.
You wave?
Yeah, I'd wave. He didn't see me.
Yeah. Did he wave back?
Yeah, he wagged. He wagged back.
Oh, good. All right. Well, good. I had 7 or 8 collies growing up.
Oh, wow.
Yes. So I'm a dog person. My wife is not a big dog person, but I definitely get the dog connection. So so anyway, a couple of years ago, you were diagnosed.
Yeah.
And
February of 2012, I was diagnosed. I had not been feeling well for 2 or 3 weeks. I'd been to my GP 3 times, and he basically blew me off. Kind of surprising because I've gone to this guy for probably 15 years, and I never go to the doctor. I'm, once a year go for a physical. Maybe I have a sinus infection or something, and I'll have to go one other time during the year. But I'm not someone who takes medication. I just have not been sick.
Right.
So the fact that I was sick and he kind of ignored it was a little disturbing. And
can I ask you, like, how you felt at this time? Like, what was the manifestation of being sick for you? I mean, how did you feel? What was going on?
I had it started with an upset stomach, so I thought I had the flu or food poisoning. We'd been out the night before. Actually, I started not feeling well on Super Bowl Sunday. And I can remember that easily because I made barbecued ribs for Super Bowl Sunday and I couldn't eat them. And I wasn't feeling well. And so then that kind of progressed, and I was having trouble, back pain, pelvic pain, weird things. And then I started getting sores in my mouth, and like canker sores.
Right.
And I had some lesions, and I had like a cold sore, and I'd never had a cold sore before. And then I got I thought it was thrush on my tongue because they had given me some antibiotics, which gave me horrendous cramps. I had to stop taking them. Never had that happen before. I had to stop taking them. I went back, and basically they just said, well, we think, you need to drink more water. You seem to be dehydrated. I'm like, okay, well, that doesn't explain the growth on my tongue, all the sores in my mouth, but this cold sore on my lip, and, all this pain I'm having. I would have chills, and I had a fever, and then I would be hot and sweaty, and I mean, it was just a whole host of things. In fact, I kept track of them. Which is not something I would normally do. I have a cold, big deal. But they were so odd and so unusual for me that I actually wrote them all out, typed it all up, and I gave it to my doctor.
So you kind of helped create the puzzle. You're trying to track what's going on. So I think that's a really important point. People that get involved, they start to take notes of things that are out of the ordinary for their personal, from their own history. So that's what you're doing. But now we're going into, this is about a 3-week period, and my understanding is it came on really suddenly.
Well, it's acute myeloid leukemia, which means sudden. It does come suddenly. And I was probably, typically if untreated, leukemia can kill you within 6-8 weeks. So, so I was 3 weeks into it. At one point, the 3rd visit to my doctor, I said, don't you think it's about time we did a little blood work? Now, this is 3 visits in 2.5 weeks. And I said, I think we need to do some blood work. Okay.
He did. So you're telling the doctor to do some blood work. Okay. And this is a primary care internal medicine doc?
Yeah. It's a primary care physician, a GP.
Okay. Yeah.
And
all right.
So in the meantime, I had also asked a friend of mine for a recommendation for a naturopath, someone I knew she had gone to see. And, my doctor thought, well, maybe it's menopause. I mean, you're in your early 50s, and I'm thinking, really? I've never heard of these symptoms with menopause before, but okay. So anyway, I set up this appointment, and I told him I was going to go see this naturopath in a couple of days. Oh, I think that's a good idea. And, drink more water. So I go get the blood test, and I don't hear from him. I went 2 days later to the naturopath. I was really sick. My husband, who hadn't missed a day of work in 25 years, called in sick to take me to the doctor. And I didn't ask him. He just woke me up and said, I think I'm going to call in sick and take you to the doctor. And so this naturopath, person I've never met before in my life, spent an hour and a half with us, examined me thoroughly, was very concerned because my blood pressure was really low, and my heart rate was really high. Again, a sign of dehydration. Well, these things in my mouth made it very difficult to eat and drink. And while I would try, I wasn't very successful. And so she actually diagnosed me with something called Buchette Syndrome, which is an autoimmune disease. And I had done some research of my symptoms, and I had asked my primary care physician about Buchette's. He said, no, I don't think that's it. And so without me saying a word to her, that's what she diagnosed. So I said, well, I thought maybe that's what it was. My dad has Crohn's disease, also an autoimmune disease. My sister has an autoimmune disease. That's possible. So
how about your mom? How about your mom?
My mom, well, she has arthritis, and she has, other issues, but nothing like that. Now, my grandfather on my dad's side died of leukemia, but they've told me it's not hereditary. So, whether that's true or not, I don't know that anybody really knows. But anyway, she said, I was so dehydrated, she wanted me to go to the emergency room and get an IV.
Right.
And she said, I think you'll feel better, and this is what we're going to do about the Buchette's, and then we'll get the blood. She tried to get my blood results from 2 days before. The doctor's office didn't have them. My husband tried to get them the next day after I was in the hospital. They couldn't find them. So I go to the emergency room, like she says, and we're there several hours, as it always is the case. And finally, they kept coming in and asking me really strange questions, like, have you been to New Guinea or something? It probably wasn't New Guinea, but it was some, odd location. Have you been bitten by a rat? Do you have, are there rodents in your house? No. Really odd questions.
Right.
And I thought, well, what does this have to do with being dehydrated? And then they came in and said, there's something weird going on with your blood work, and so we're going to keep you so we can run some more tests. Okay. So my husband Tim goes home, take care of Casper, and get me some clothes and that kind of stuff. Mm-hmm. We live not very far from the hospital, and so he's gone, and in comes this doctor. His name is Tim Carlos, and he tells me he's a hematologist. And so
that
anyway,
got your attention.
Yeah, he did not tell me he was an oncologist. He told me he was a hematologist.
Hematologist, right.
Yeah, which he is. So he asked me probably 40 more really odd questions. And then he said, well, here's the thing. We are pretty positive you have leukemia. And he said it's called acute myeloid leukemia. It's AML. And then he had a prepared worksheet, and he showed me the plan of attack and how we were going to how we were going to do chemo and what that would involve and all of those kinds of things. And at the very bottom, it has the survival rate, and that is 30%.
Oh my gosh! Yeah.
At
the bottom of his sheet.
Of his worksheet, and he pointed it out to me. And Dr. Carlos is he's a very humble, dutiful person with lots of integrity. He's not overly demonstrative or happy, sad, one way or the other. He's kind of stoic, and I couldn't really read him, but I immediately trusted him. He just seemed like he knew what he was talking about. He knew what we were going to do to attack it, and he knew what the chances were. And he didn't sugarcoat anything, but he was also positive about it. He didn't make me any promises that I was going to be one of the 30%, but he also didn't make me feel like there was no chance that I could be one of the 30%.
Yeah.
And I've since told him how much I appreciated that.
Isn't that amazing how the impact of that bedside manner
Yeah.
is critical in your confidence level.
Yeah. Because I was completely, and still am completely and totally confident in his ability to do whatever he could do to save my life.
Right.
And so, he admitted me, and then they started the process of getting me ready for chemo. You had many more days of straight chemo than I did after I read your bio. I had 7 days, 24 hours a day. And I actually tolerated it fairly well. I had some allergic reactions to antibiotics and those kinds of things. Had strange things happen. Food allergies that I've never had that I still have now.
Right.
Weird things that resulted. But.
So can we turn the clock back just a second and go back to how you felt when they told you this? I mean, most people are pretty shocked, and you're just not really good words for it. But I mean, I would assume that it was. I mean, can you just revisit that moment
Sure.
a little bit?
When he told me...
it was just the two of you?
Yeah, it was just the two of us.
Okay. So Tim wasn't there?
Tim wasn't there. He was home. And and so when Dr. Carlos told me, and he said, he had asked me where Tim was, and I said, well, he went home to take care of the dog and get me some clothes because they said I have to stay. And so he said, okay, so after he told me, at the moment that he told me, in fact, I think I said to him, well, what about Buchette Syndrome?
Right.
I think I like that option better.
Yeah.
And he said, well, no, we'll run some more tests tomorrow, but we're pretty positive that's not it. He said, your blood work indicates leukemia. And so then he said, I'd like to talk to Tim. Is it okay if I call him? And I gave him his number, and he called. He stepped out of the room and he called and talked to him, and then he came back and told me that he had gotten a hold of him, and that he was also going to call my GP, who he tried to talk to 3 or 4 times, and the guy never called him back.
Golly, this is wow.
Yeah.
That's frustrating.
That's frustrating. But anyway, so then Tim came shortly thereafter. But I remember they came in, and it was like 6 or 7 o'clock at night, probably 7. And they said, do you want something to eat? Well, of course, I was having trouble eating, but they said, we can get you a tray. And I said, okay, sure. And I remember sitting on the side of the bed, eating this cold hospital chicken that was, hard and overdone, and the thought that went through my head was, he just told me that I had leukemia, and I'm sitting here eating a piece of chicken that normally I would just pass up. Why am I eating this chicken?
Yeah.
Which is a really odd thing to think about.
Yeah.
But after I of course thought about what he had to say. I don't remember ever thinking, I could die from this.
Right.
All I remember thinking was, this is going to be really difficult, and I'm going to have to fight like I've never fought before in my life.
Right.
And
kind of that attitude, like, I'm going to have to figure out a way to outsmart this thing.
Yeah.
You strike me as one of those people that just says, how are we going to outsmart this thing?
Yeah.
It's not going to get the better of me.
Yeah.
So.
And I did feel like that. Now, my husband was pretty devastated. And like I said to you the other day, I think it's much more difficult for the other person. Had I been on the other side of that and he were the one with the diagnosis, I probably would have fallen apart.
Right.
But I guess I just said, well, we're going to deal with it, and whatever happens, happens. I'm not afraid of death. I know where I'm going. I know what comes after this. So that wasn't it, but I certainly had no desire to die.
Yeah.
So every reason to fight. And so I also was maybe trying to be a little stronger than I felt, because I knew it was so difficult for him.
Right, and I think that's a key point. You and I were talking before the show a couple of days ago, and we were talking about how it's an effort by the patient to actually protect their loved ones around them, that they don't really verbalize a lot of what's going on. So I think that's really critical to point out. You know, it's a courageous act that you're doing. You know, it really is. It's a very courageous thing to be doing. I can remember having similar situations, because I had a young daughter come in and visit me. And she was so shocked. I just remember the shock on her face at seeing me, that I had to really try and overcome that, how I felt, and try and make it as unpainful as possible. But anyway, so
that's what you do.
So Tim came down and visited you then in the hospital, and
he by the time he came back, which was maybe half an hour, 45 minutes after Dr. Carlos told me and had then called Tim, he had called his boss at home. He's been with Hyatt for 25 years, and so he had called his boss at home, told him what the situation was, and told him that he needed a leave of absence. And of course, you know, when you're undergoing cancer treatment, generally you're in a private room, and the rooms at Evergreen were actually very, very nice, and Dr. Carlos had told him that he could stay with me if he wanted, and there is kind of a twin bed in the room at Evergreen, and so that was his plan, was he was going to stay with me until I got out of the hospital, since I had to be there for a month. And
the doctor okayed all of this?
Yes.
He did, okay. And the hospital was okay with this?
Oh, hospital was absolutely fine. In fact, they encourage it.
Okay. That's actually an unusual circumstance. I've seen a lot of situations where they'll throw the family member out. You know, so sounds like you've got a pretty progressive thinking group up there. So
yeah, they are, and they were incredible. I mean, there was I made friends with the nursing staff, and not just the nurses, but some of the aides, and one woman moved to Minnesota, and I still email her, and she was one of my nurses. Anyway, it was great because Tim was able to. He just moved in, and that was really helpful to me. I actually felt kind of bad for him because they wake you up in the middle of the night all the time, and he's told people since then. He's like, I'd hear somebody wake up, it'd be 2 a.m, and he said, here's Lori just having this conversation with the nurse who's taking her blood or whatever. It's the middle of the night. She was sound asleep 2 minutes before, and now she's just having a conversation.
Right.
And I said, well, that was kind of one of our, that was kind of one of the things on that very first night that Tim and I talked about, was that we wanted to be kind to the people who are trying to help us. And
wow.
And we wanted to, in whatever way we could, serve them, because they have horrendous jobs. They see things that I don't know how they live with it. I mean, they see people die all the time, and especially when you're working on an oncology floor, you see, a high percentage of the people that you meet and get to know won't be there in a month.
Right.
And so I just kind of had some empathy for that kind of situation with them.
So you and Tim consciously thought about how, number one, how you could be kind to those people that were working with you, and number two, how you could serve them.
Yes.
That's unbelievable. That's
well,
awesome.
It sounds like like it's a very unselfish thing to do, but I'll be really honest with you. It probably is not unselfish. I get as much or more out of it as the person that's being helped.
I agree.
And the harder thing for us to do was, and we had to consciously make this decision too, was to let other people help us.
Right.
because we're both kind of behind the scenes people who we just like to quietly do whatever it is we do, and if somebody needs help, we help them, and we'd really rather no one even know.
Right.
And so to accept help is really, really difficult when you're the person who generally, likes to be the one who helps somebody else. So,
yeah, I had forgotten all about that, actually, Lori. I'm glad you brought that up. You're bringing back some memories for me. But,
I can see it in your face.
Yeah, it's hard. I'm one of those people. It's really hard to allow people to help you.
Yeah.
That seems an odd thing to say, but that's a difficult hurdle to
overcome. A lot
overcome.
of people have that problem. And so it was hard, and we did have to, both of us, say we will let our friends and family help us, and we can't do it by ourselves. And I knew that I needed medical help, of course, but to let people do things like not so much during my first stay, but for every stay thereafter, I spent 3 other weeks. Every month I had to spend a week going through chemo and stay in the hospital.
So take us through the protocol a little bit. Yeah, the process.
So the protocol for AML is you're in the hospital for a block of 30 days. They give you 7 days of chemo, 24 hours a day. They let you recuperate for a couple of days, and then they'll do a bone marrow aspiration to see if the chemo has had an effect. So for me, that aspiration was on March 15th. We got the results on March 16th, and there was no evidence of leukemia. So I went from, they're called blasts.
Appropriately blasts. Named, yeah.
Yes. And I had in my marrow 82% leukemic blasts when I was admitted. I had 64%, I think it was, in my bloodstream. Pardon me.
Wow.
This is a runny nose is a forever thing for after a transplant. Yeah. Anyway, so when they did the after the chemo and they did the test, I had 0.02% blasts in my marrow, from 82% to 0.02%. Basically zero. Everybody has some, so that was well within normal range. What they discovered was I also had a gene called FLT3, FLT3, and that gene typically causes the leukemia to return even after a prolonged remission. So that was problematic.
Right.
Once you get past that 30 days and you get to go home, you're in remission. You go home for a month to kind of help your immune system recuperate. And then you have to go back for a week, like a Monday through a Saturday. They give you 2 doses of chemo every day for I guess it would be 3 days, because it's like Monday, Wednesday, Friday, in the morning and at night. It runs about 4 hours. So you kind of have a day off to recuperate in between.
Right.
Then once you get through that first week, you take a month off, do it again, month off, do it again. So 3 rounds after the initial 30 days.
So have they taken out... have they done any stem cell collection prior to doing the chemo? Or
yes.
They done.
They did a bone marrow aspiration, which is your stem cells, and actually I've looked at it. I'm not really somebody who likes to look at that stuff, but I finally got curious enough that said, "Can I see it?" And it kind of looks like little grains of rice.
Okay.
And you can see it, very well in the cup that they collected in. They don't take very much. It's a very painful procedure. They use a needle that I refuse to look at, but I understand is quite long. And my doctor's no small guy, and it was everything he could do to jab that thing in my pelvis. So it is quite painful, but it's necessary. And so yes, they had collected some, and then they collected some again on the 15th.
But they collected it before they started any chemo?
Yes.
Okay, so they've got stem cells. See, yeah, okay. I'm just curious. We had my mother-in-law had a stem cell transplant, but they had given her all the chemo and then went in to do stem cell collection, and then, with the idea of doing a stem cell transplant and retransplanting, but there weren't any stem cells to go get.
Right.
So it was kind of one of those things, gee, guess we should have thought of that beforehand, guys,
Yeah.
so... Anyway.
But what they collected from me was so small, it would not have been enough for a transplant. It was just simply for testing. To give you an idea, there were maybe, I think I asked him once, and while the naked eye didn't really see 40 or 50 stem cells in there, I think that's what he told me were in this little cup. But to give you an idea, my brother, who was my donor, they needed 5.5 million stem cells to give me for transplant. Now he is an overachiever, and so he donated 11 million.
Wow.
And really 5.5 million was just a bag, like you get a blood transfusion.
Wow.
So it doesn't look like, no way can that be 11 or 5.5 million stem cells, but it was.
So you had your brother was a donor, and didn't you have another donor as well?
My sister was also a match. I have 3 siblings. 2 of the 3 were a match. Pretty unusual. 25% chance that you will have 1 sibling who's a match. So the fact that I had 2, yeah. It's interesting because as much as I love the SCCA for saving my life, although I really credit Dr. Carlos with that because he was the guy quick on his feet. Right. When we initially had a consultation with them, it was, I'll say it was the worst day of my life. It was worse than finding out I had leukemia. The doctor who did our consultation there wasn't a positive moment in that conversation. 3.5 hours of, well, you could die from this, you can 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 die from this. And I understand the need to make sure you understand that there's risk to what you're doing. Because you're signing a lot of documents to say, yeah, I agree, I understand the risk. I get that. But we kept waiting for him to say, but the good news is, there was never
came out.
No.
Now, this was the actual transplant surgeon that you're talking
about?
No.
So how the Seattle Cancer Care Alliance works is they kind of have 3 or 4 different arms. So when you go there for a consultation, the doctors rotate. And they rotate from consultations to research to treatment at the Cancer Care Alliance, which is not a hospital but more of an extensive doctor's office, and then they rotate at University of Washington Medical Center, where they actually work on the floor with patients. So they're working in the hospital. So they rotate between those things. They all have one interest or another that is more near and dear to their heart. A lot of them are research oriented, and they're all smarty pants. They're all brainiacs.
Right. Yeah.
So
do they treat you that way? So some of them can be brainiacs and know how to communicate to a patient, and some of them can be brainiacs and have no clue, and it's my way's the highway, it's my way or the highway type attitude. So it sounds like you ran into one of those guys.
Yeah, he was like that. I have since spoken with other people who had similar experiences with different doctors during their consultation. Whether that's just a normal...
Do you have an opinion as to whether or not that changes the your anything about the outcome? In other words, that
Yeah.
that relationship between the doctor being a partner versus he's the dictator and you're the serf, and he tells you
Yeah.
what to do. How
It,
did?
it changes
What's
it.
your perspective on that?
Well, so after we met with this guy, I didn't say anything to Dr. Carlos, who's my oncologist, uh, and maybe 2 weeks after we met with, I can't remember his name. I always want to call him Dr. Death because that's all I talk about.
We'll just call him Dr. Death, Dr.
Yeah.
D. All right, so Dr. D.
So Dr. D. So he wrote this like 5-page letter recapping all of the very bad things he had discussed with us, so we were sure to understand the chances are not good. And he copied Dr. Carlos. So I had an appointment with Dr. Carlos, and we finished the appointment, and he said, by the way, I got that letter from, he goes, what's that guy's name? And
Yeah.
so whatever it was, and I said, yeah, and he goes, yeah, I gave him a call. And I said, you did? And he said, yeah. He said, after a lengthy discussion, he agreed that perhaps he was a little more pessimistic than he needed to be.
Right.
And
so you didn't have to say anything.
I didn't say anything. Yeah, and then he said, okay, so I know what he told you, but here's what I need you to remember.
Okay.
And he said, you've tolerated chemo very, very well. He told me from the very beginning that if I walked, I would do better. So even when I didn't feel like it, I needed to get out of bed and walk. And so I did. He said, you walk like a crazy person. I got to where I was walking 2-3 miles a day around the hospital, on the floor, on the oncology floor. He said, you walk like a crazy person. You're young. You're otherwise completely healthy.
Right.
You don't have anything wrong with you except leukemia. He said, you have a really great attitude. I brought work to the hospital. I brought my laptop. I planned to work the whole time I was there, and I did. Mm-hmm. And he said, so, all of those things are very positive and have a huge impact on your outcome. So those are the things I need you to think about and to remember, and not the things that he told you.
Wow.
And that to me was, because he is not a touchy-feely guy,
Right.
and the fact he picked up on how negative it was and how impactful that could be, that made a huge difference in how I looked at how I would react to whatever else happened. And this is a guy who, on the day of I was no longer under his care while I was at the SCCA, but on the day of my transplant, he called me in the hospital to wish me good luck. He sent me emails, if you have questions or you need anything, or anybody asked you a question that you don't know the answer to, here's my phone number, here's my email, they should get in touch with me.
Wow. Now that's a doctor.
Yeah.
That is awesome.
He's incredible.
That is just awesome. I've always felt it's not that hard to take that extra little step to give that person in a crisis the confidence they need to fight, and to just the confidence that they need. And so that's an unusual physician. I'm so happy for you that you had him as your wingman.
Oh, I think I would have felt completely differently, but I just felt like he was in my corner, and
Right.
The other thing he would always do that impressed the daylights out of me, he still does it. If I were in the hospital, he would wait when Tim was back to work. He would wait to come in the afternoon to see me until he knew Tim was there, so that if Tim had any questions, he could talk to him. And he still asks me about Tim. He still asks me about Casper. He's just he's just a really unusual doc, and like you say, it's too bad there aren't more who get that, because I think patient outcomes would be better. There was a woman I met that one of the nurses put us together. We had to both give mutual consent that we could talk about, she could talk about us to the other. Turned out we went to the same church, and that's how she put us together. But she didn't make it. She had lung cancer, and she didn't make it. But Dr. Carlos was also her doctor. And when I saw him a couple of days after she passed away, and I told him I was sorry, and he had tears in his eyes and said, I thought we had a better chance at saving her. Mm-hmm. And so, he's not an emotional guy, but he is caring, and it does make a huge difference.
So if you were looking back, and you're now 2 years since the last treatment, or?
Yeah, I'm 2 years, 3 months since my transplant.
2 years, 3 months since your transplant.
And
so if you were kind of looking back historically and saying, I wished I had known X, Y, or Z, but when I started this process, is there something that kind of stands out in your mind as that you wished you would have known, or that you would like to pass on to other people who might be early on in this big learning curve?
Yeah. Well, I think that the thing that, and I mentioned this to you the other day, but I think the thing that I learned that I didn't immediately know was that you don't have to do everything they tell you.
Yeah, that's a big lesson.
You can question what they tell you. I would say I'm kind of a rebel. I'm someone who doesn't necessarily just follow blindly behind authority. If it makes sense, I'll do it. And if you tell me I have to do it, well, if you happen to be my boss and you tell me I have to do it, well, I'll think about whether that's something I really am comfortable doing, and if it's not, then I'll go find another job. That's just kind of my personality. But when it's your life you're talking about, you kind of tend to think, well, they know what they're talking about. I don't know what I'm talking about. I need to listen to everything they say and do everything they say the way they say to do it. I got over that.
Right.
And so I think, one of the things that it seems silly but made such a big difference was deciding after that first stay that I was never going to wear a hospital gown again. When I went back the second time, I had a port. You're probably familiar with that.
Yeah, I've got one right there. Yeah.
Yeah.
I had right.
Yeah. Yeah, I still have a scar.
Yeah.
Part of it's still in there, actually. They didn't get it all out.
Oh, really? Wow.
Yeah. But so I had a port, and so that makes things, once you put that hospital gown on, that's kind of the only thing you can wear when you're hooked up to an IV pole. So I modified men's sleeveless T-shirts with Velcro so that if they had to access my port or whatever, they could, and I could wear street clothes and not wear a hospital gown. So I took, I spent time sewing these things, and I took what I thought I needed to be able to make it work for them. So the second time I had to go back for that week, I just determined I wasn't wearing a gown. And when they on my first day, they walked in, they put the gown down on the bed, and I said, yeah, you can take that away, I'm not going to wear it. And okay. I said, now I don't want you to get in trouble, so if somebody says something, just send them in and talk to me. Okay. So I never again wore a gown, including when I had my transplant. I took street clothes. I got up every day. I did my routine just like I do at home. I got up, I cleaned myself up, I changed from my pajamas to my street clothes, I put on my tennis shoes, I made my bed, I cleaned up my room, and then I walked. And
so you drew a line in the sand, and you said, "This is my terms. I'm doing this on my terms, or you guys take a hike."
Yeah. And
that's what
they were,
you
of course, fine with it because they're all really great people.
Right.
And they even thought that it was a good idea. Even the administrative person for the oncology floor came in and talked to me a couple of times, because she said, all the staff sees you out there walking in your street clothes, and she said the patients see you out there walking, and she said we have people getting up and walking who have never left the room because they see you do it. And so I said, okay, well, I'll keep doing it. And
wow.
And shortly thereafter, another nurse, a friend of mine, said, yeah, they do see that. But I had by that time gotten a wig. And she said, I think if you didn't wear your wig, she said, sometimes they think you're just someone visiting a patient. Because you're in street clothes, you don't have a pole, you're just, you're walking. And so I said, okay, I'll never wear my wig again at the hospital, and I didn't. And there were even times when I had family members of other patients approach me in the hall and ask me to go talk to their loved one who was fighting because they thought they needed a little encouragement, and to try and get them to get up and walking. And so I did that, and I remember even praying with somebody in the hallway one day, and that was really something. I mean, she prayed for me, I prayed for her. It was really incredible. And so, those kinds of things, they were very encouraging to me, that not wearing a gown and being positive and trying to encourage other people was probably more important than I ever thought it might be.
So it actually became part of your healing process. It was, you were drawing a line in the sand, you took some control, you took some responsibility, you were getting some you were healing by helping others. Really?
Yeah,
it sounds
I think
like,
so.
I mean, it sounds like that's what I see. That's incredible.
I would say that's probably true. Not that I really thought about it that way.
No, I know.
I just didn't want to be a cranky pants.
Right.
I've had that experience with a neighbor who can sometimes not be the nicest person when she's well, and so when she's sick, she's really not nice, and not nice to the people who are trying very desperately to care for her. And I even heard that there was a guy down the hall from me just every day screaming at those poor nurses. And
do you feel that, I'm sorry to interrupt, but do you feel that you've changed since in the last couple of years, and how, if so, how?
I think I'm probably less patient than I used to be. I think you kind of don't see the point of a lot of things.
Right.
I'm less patient with people who are complaining about what I consider to be trivial, stupid things. And maybe after you've been through something like this, there are a lot of things that you consider to be trivial that before were probably important to you.
Right.
And now they're less important. So that's something I have to kind of be careful of, to not trivialize someone else's problems or situations just because they're not monumental. I think I've also changed with regard to I was always a hard worker, and I still work hard and I want to do well, but it's not that important to me. I just think life's short, and when my work day is done and I've done everything I can do during that day, that's it. Shut it off and go for a walk.
Yeah. So would it be fair to say that I know this was true for me. I won't put words in your mouth, but it sounds similar to my experiences that, some people, I was a very type A person, super driven, and I came out of the experience and I was not at all that way. And, I think I think some people around you have trouble adjusting to that, but
Mm-hmm.
there's time becomes more important than achievement. You know, time is really everything, and one of the things that really seems clear to me is that there's always time to take an extra step to help somebody else.
Mm-hmm.
It almost seems like time slows way, way, way down when
Yep.
you're in the hospital, and you have to pay attention to the smallest details. And
Mm-hmm.
I mean, it's a big event to go to somebody else's room, to
Yeah.
talk to them about your experience, to pray with them, to inspire them, or vice versa. They'll inspire you, or a nurse, or somebody in the elevator. You never know where it comes from. So it just, when you carry that experience like you're doing outside of it, and you go back to work, it's kind of, you know, you're less inclined to get on the rat race, or to get back onto that
Yeah.
train. You know.
Mm-hmm. Yeah, I'd say that's very true. I feel that way. And, you know, I'm self-employed, so, you
Right.
know, obviously I still need to keep those clients happy.
You
and-
know, yeah, I keep interrupting you. I apologize. I just have my thoughts are going in a lot of different directions as you're talking. One of the key things that you and I had talked about before that I just wanted to touch on before we go was how the whole experience had touched and kind of attacked everybody in your family. So I mean, you have the disease, it's you,
Yeah.
but then this thing has a huge ripple effect on everybody around you.
Mm-hmm.
And sometimes that ripple effect, you're the one helping them. You know, you're the patient, but you're the one being a support person to the ones around you.
Mm-hmm.
And I think there's a lot of people that can relate to that. Am I characterizing that?
Yeah, you're characterizing that correctly. Yeah, I felt it wasn't a burden, but I felt a need to kind of protect the people that I love.
Mm-hmm.
And I think I mentioned to you that there were only a couple of days. I think there were 2 days, the first 30 days I was in the hospital, when I said I just can't see anyone. I felt awful. I had chills all the time. I was a mess. You know, you lose your hair, your dignity. You just don't want to see anybody.
Yeah.
And I wasn't feeling sorry for myself as much as I just didn't want them to have to see me like that. It was
Right,
hard.
because it's a shock for them.
It's a
They're
shock.
shocked. Yeah.
I was shocked. You look in the
Yeah,
mirror and
you're shocked. Yeah.
who is that?
Yeah, I know.
That's not me. You're bloated. You just do not look like yourself. And it's hard to be that positive person. And I didn't want them to worry. So it was easier to say, I don't feel good. You know, I just need a couple of days by myself. Now, I had one friend who didn't let me off the hook, and who brought another friend, and we had a nice long conversation. But for the most part, I was off the hook. And but you do want to protect the people that you love, and you can do that in various ways. I mean, most of my family was not here, so we talked on the phone every day. We emailed. I had a Caring Bridge website, so I sent messages out to everybody nearly every day. If I missed a day, Tim would send a note that said, today's kind of a rough day, but she's doing better this evening, and she'll be back on tomorrow, or whatever. And I had a friend who came to the hospital every morning and walked with me. And so, those kinds of things, and she probably saw more than anyone, because we just walk and talk like women do.
Right.
And so she probably saw when I really was not maybe emotionally as strong as I was on another day.
Right.
She was there the day he told me I went in remission, and that's when I lost it, because you just put up this big front the whole time, and you don't realize how much it's weighing on you until someone says it's okay. You're going to be
the
okay.
Finish line. Yeah, you crossed the finish line.
Yeah. So
awesome. I'm
yeah.
so happy for you.
You too. I read your bio and what you went through, and it's hard, right? I mean, it's very difficult. And not just physical.
It's not just the physical part. I think the physical part I expected. It wasn't. It was the emotional part that I didn't really. I wasn't prepared to lose control. I wasn't prepared to be completely lost in the system, trying to outsmart poor decisions, and there's a whole reason. That's the whole reason we created Stories with a Purpose, really, and kind of that's really what the Smart Patient Academy is all about, is trying to tackle that inner game of the healthcare experience. I think that's where it all begins, is right there, and then the outer game's is kind of more of a manifestation of it. I don't know that we can actually just to be clear, there's a lot of people who came to me, and this always made me a little upset, that people just seem to have this. I'm from California, by the way, so there's this California mentality that if you just have these great positive thoughts, all of a sudden, you're going to be better.
Right.
And maybe that's true, but I saw people with horrendous attitudes get out and people with great attitudes not make it. And
right.
But I do think that there's an element of it in that how you think changes the outcome of the care. So it's how you interact with that doctor, because there's several pivot points as you go through, pivot points of your care, and pivot points that can change an outcome on what you decide to do. And some of those pivot points we like to revisit, because people like you and I can give others the confidence that they need when they're going through it, or we can be talking to somebody who's caring for somebody who is, and they don't really have the confidence to go challenge a doctor, to go ask for a second opinion, because they're afraid they'll alienate the doctor, the primary doctor, by asking for a second opinion. Yep. And it's your life. You know what? You've got to draw a line in the sand, and your line in the sand was incredible. It was. I'm not putting on that stupid gown anymore. I mean,
well, and there was actually a bigger line in the sand when I had my transplant. You just made me think of it, because I had a doctor who, with the Cancer Care Alliance, when you have a doctor, you have them for maybe a couple of weeks, and then you get another doctor. And so when I went in for my transplant, I probably had 3 or 4 different doctors. I had one constant. Her name was Susan. She was a fellow, and she wanted bone marrow transplant to be her specialty. And so she was there the entire time. And this doctor was my first doctor. And a few days into it, he had told me about a pain pump. And he said, by usually day 4, bone marrow transplant patients are on a pain pump. And so I said, okay. He said, so, don't put up with pain, just tell us if you need it. Okay. Well, so day 4 comes and goes, day 5 comes and goes, day 6 comes and goes. I had some pain in my back, but not a ton of pain. Nothing that if they'd given me a Tylenol, I would have felt better.
Right.
And so...
were you chomping on the silver bullet the whole time, though?
No, not really. But he was, because it bothered him tremendously that I was not on a pain pump.
Yeah.
And so...
Something's wrong with you, Lori. You've got to get on a pain pump, It's self-administered morphine. Why wouldn't you do this?
And so there did come a point I hadn't slept in a few days, just because it hurt to sit and it hurt to lay and those kinds of things. And so I finally said, I told Susan, maybe you could give me a little something, but I'm very sensitive to pain medication. So, and I'd had all these allergic reactions, so I was a little bit chicken to try something new. But I knew I'd had one thing in particular, and it worked okay. So she said, okay, we'll give you that. She said, but I'm going to give it to you in the smallest dose. And so I, okay. Well, it knocked me out for like 12 hours. And it was the smallest. This is like what I would give a child.
Right.
And it knocked me out for 12 hours. So.
But it killed the pain. See, it killed the pain. Yeah. Right. There you go.
For a few hours. Yeah. So, anyway, this doctor kept asking me, and one day he came in and he was very upset with me because I wasn't on the pain pump. And he kind of got in my face, and I mean, really, literally, kind of up close. And he was there by himself. She wasn't in the room. And I don't understand. You don't need to be a hero. Blah. I was like, I'm not being a hero. I'm just not in that much pain, and I don't see a point to take pain medication to make you feel better.
Good for you.
So if I need a pain med, I'll ask for it. I did. I took it. It's fine.
Wow.
So the next day he comes in, he starts in again. And I finally said, okay, enough. Listen, I don't know what your problem is. I'm not sure why you think it's so critical that I be on pain meds. I'm fine with how I feel. I am not in that much pain. If you just give me a Tylenol, I'd be fine. I don't even think I need that. So you've harped on it enough. I understand your side of the equation, and I will take pain meds when I need pain meds, but until then, please don't bring it up again.
You go, girl.
Yeah. And so,
what'd he say?
Well, he got this funny look on his face, and about that time Susan walked in, and he was, again, kind of in my face.
Uh-huh.
And so he turned around and left. And so Susan said, what was that all about? And I said, I don't know why he's so upset. I won't take pain meds. But Susan, I'm not in that much pain. And I said, are you concerned that I'm not on pain meds? And she said, no. She said, I gave you the smallest dose I could give a person. And it knocked you out for 12 hours. And she said, so, if you need it, you'll ask. You did. You do not need to be on a pain pump. Mm-hmm. And I said, well, I hope I didn't hurt his feelings, but I've about had it with him asking me about it. And she's like, don't worry. And he never asked again.
You were very kind compared to other patients, including myself, who would have been a little more colorful. So you were very gentle and did a great job. Did a great job.
I was angry for me, but I know that sometimes doesn't equal anyone else's anger, but
that's awesome.
But you just have to, if they're pushing you and it's not something that you feel you need to be pushed about, you just need to push back. They're smart people, but they aren't you. It's not their body.
And and there's an element of this where you're in control and you're in the driver's seat, and we try and make that clear. What is that distinction? People are, you and I, you go into a situation like this, and there's all these assumptions that you naturally somehow know what the rules of being a patient are. Nobody tells you that, and it changes from doctor to doctor, from hospital to hospital, and so. That's one of the values I think an interview like that you're doing here is brings to the table. So, you're also been to the kind of the limits of what healthcare can do as well. So you're bumping up on that ceiling. Beyond this.
Yeah, but there's nothing we can do.
There's you and God. There's you and some alternative medicine therapy or something like that. But you're bumping up against the ceiling of care. So what you and I are talking about are skills that can be cross-purposed to something less severe, to much less severe. I mean, going back to when you were in that primary care doctor's office.
Yeah.
And just getting slightly more assertive.
Irritated.
Irritated, assertive, whatever. I mean, you went through the 3 times there and finally just took the ball out of his hands and said, I'm not doing this anymore. I'm going around you to figure out what's wrong with me. That's essentially what you did.
Yeah, that's essentially what I did. Now,
that saved your life.
It did save my life, and after the fact, I thought about it for a very long time because, again, I didn't want to be unkind. Here's a person I've known for a very long time. He's a very nice man, but I felt ignored, and so I wrote him a very long letter, and I told him, listen, I don't hold you responsible for my illness. Obviously, you're not. But I do hold you responsible for ignoring me when I told you my symptoms, when I gave you a full page full of odd and strange things that were happening to my body that were out of the ordinary and would be out of the ordinary for anyone. And when I read back through that list, there were even things like bleeding gums. And I have since learned, of course, that's a sign of a blood disease, bleeding gums. Mouth sores, that's a sign of leukemia. I have a friend who's a podiatrist who said to me, boy, when I gave him my list of symptoms, he said, I would have come up with the fact that it was something serious and leukemia. He said, the minute you started telling us what was wrong with you, that's what I thought. Mm-hmm. So I just said, listen, here's the thing. When you have a patient who is not a hypochondriac, someone who doesn't come to you over a hangnail, comes to you once a year for a physical, and they come to you and say, these things are wrong and going wrong, then all I ask is that you pay attention to that person and you give them the care and the and whatever else needs to be done for that person to make sure that you're not just ignoring them.
Dig a little deeper. Yeah, just take the time to dig a little deeper and stop scratching the surface. And well, Lori Owens, you have been an inspiration to many people. I know you will be going forward, and I am so glad that you joined us.
Thank you.
So one of the things we're hoping to do is we have a forum on Stories with a Purpose, which is going to be linked with these podcasts. Mm-hmm. And we'd like to, with your permission, obviously, we'd like to put you up there on the forum so that people who hear the podcast could go back and go, what a great story, Lori. I have X, Y, and Z going on, and could you help me? Or have you ever thought of this? Or just some back and forth possibly with you. So if you're willing to do that, we thought that would be a great way to connect with people and let them follow up and just kind of keep the vibe going.
Sure, I think that would be great, and that kind of goes along with our commitment from the very beginning. That if there's a way that you take a horrific thing, and if you can help someone else through their horrific thing, then it gives meaning to having gone through it. And so if there's some way I can help someone else, then I would be more than happy to do that. So thank you for involving me, and thank you for the opportunity to tell my story and to get to know you. And you have a tremendous story yourself, and it's great that you've created this company to to help people through the process that can be very difficult.
Yeah. Well, you go through it, and there's always this feeling of you're here for a reason, and you made it through this process for a reason, and I think part of it is to give back some way. And I think a lot of survivors and a lot of people who are going through things have just these incredible stories pent up in them, and they're incredibly valuable to others. And so that's the whole point of the exercise, is just to unleash these stories and let people learn and see where we can go from there. So anyway, thank you so much, Lori. We'll be in touch as we go. And I don't know, Jamie, if you want to join us back at some point here and unmute. Are you there, Mr.
Yes,
Producer?
I am.
Good.
Hey, Jamie.
That was quite the story, Lori. I'm so glad we were able to capture that, and I'm just blown away by your courage and everything, and you helping people. I've taken notes, so I'm going to put those on the show notes, and so that people can look at those and really just get help where they can.
Yeah, well, and it's and sometimes it's helping somebody else that will help you more. So
exactly.
In the show notes, Lori, we may be back in touch with you regarding on some of the show notes. One of our goals is to take little details, like you mentioned, say that gene. We would like to put in the show notes a little, maybe some bullet items of things that you'd mentioned. The particular institution that you were at,
sure.
And just any details that come up, because who knows, one little detail may make a huge difference in somebody's life. So we may be in touch on those issues.
Okay, if you need clarification on anything, or and that FLT3 technically is called FLT Frank, Lori, Tom, 3, and then it's followed by the words LTD, like limited, LTD.
Right. Flit Limited. Okay.
Flit 3 Limited. Yeah.
Flit 3 Limited. Boy, that's a mouthful. Okay.
Flit 3 LTD is the technical term, and where it is, where it resides, I can't tell you any of that stuff.
Yeah.
But that's the nasty gene, and the miraculous part of it is, once my transplant was done, that gene is no longer in my body. Yeah. It's gone.
Wow.
Yeah.
That's an incredible detail. Okay.
Yeah.
Well, we're going to put that in the show notes as well.
Yeah, it's gone. So, and that's the purpose of the transplant, partially, is to get rid of that gene. So,
Dang.
and it does. Yeah.
Welcome
so now I have a mustache because my little brother is obviously a male. But
yeah. Well, welcome to the 30% that's hopefully growing to the 50%. So.
Well, the good news too, I didn't think I mentioned this, but after transplant, my odds went from 20% to 70%. They actually go up for every month that you're a transplant survivor. So at the first year, I said, how much has it gone up? Has it gone up? And they said, oh yeah, once you hit that year mark, they said, 5 years is of course the mark they're trying to hit. But
Right.
once you hit that year mark, it's like 80% of getting to 5 years. So
Awesome.
yeah, so it makes a big difference. So
Well,
so anyway, my odds are
congratulations.
much better. Yeah.
Congratulations, Lori.
You too.
We
You too.
really
All right.
appreciate it. So hopefully you like Google Hangouts now. You got a new
Yeah,
tool.
it's kind of cool. Yeah.
It is pretty cool. So we'll keep you posted. It's probably another couple weeks before we actually go broadcast this, but it's going to be out on iTunes under Stories with a Purpose, and we're going to release probably 3 to 5 stories immediately, and then have a rolling number of them afterwards. So anyway, we'll just keep you posted, but it's not too far off. Probably 2-3 weeks, somewhere in there. We'll keep you posted. Okay.
Terrific. I have some friends who've asked. So
Awesome. And
all right, thanks very much.
Give Liz a howdy. All right.
I will. I'll give her a hug for you when I see her.
Okay, please
All right.
do. Thanks,
All right.
Lauren.
Take care, Jim. See
Bye.
you, Jamie.
All right.
Bye-bye.
Bye-bye.